Every hospital has a doctor who doesn't order occupational therapy. They'll order physical therapy, but just don't see the benefit of OT. They may have had a bad experience with OT, or maybe they don't understand the purpose of OT or how it's different from PT. Or they just may want to speed up the discharge process. Now, this can be problematic, but there is one question you can ask doctors to help them think differently about OT. Now, before I answer that, let's look at why OT is so important. First of all, what is OT? It's difficult to define OT in one sentence or a paragraph. AOTA actually has an entire page about OT. In general, OT is about making life more meaningful through therapeutic, everyday activities. OTs assess and treat conditions related to cognition, memory, language, executive functioning, pain, depression, functional mobility, ambulation, transfers, and wheelchair mobility. They can also help with vision, management of feeding, driver rehabilitation, community integration, and social participation. OTs may work on exercises to increase fine and gross motor coordination, upper extremity strengthening, or they can fabricate splints, orthotics, or help manage prosthetics. In addition, OTs help patients increase independence with their ADLs and IADLs. In summary, when OT does an evaluation or assessment, they look at everything. OT doesn't just focus on a physical aspect of a patient's condition, like physical therapy. OT focuses on the physical aspect and everything else. There's actually a really great research article titled "Higher Hospital Spending on Occupational Therapy is Associated with Lower Readmission Rates." The authors found that occupational therapy is the only spending category where additional spending lowered readmission rates. Isn't that crazy? If more money spent on OT helps lower readmission rates, why aren't doctors ordering us? So if you want to help doctors understand OT better, ask them this. What does PT do that OT can't do? And they're probably going to say that PT focuses on gait while OT focuses on ADLs. Now, ADLs are important, but the doctors are missing the mark. And this is how you should respond. An OT can do just about everything a PT can do, plus a whole lot more. PT and OT aren't that different in their approach. While PT may primarily focus on the biomechanical approach, OT already does that. And they assess cognition, fine motor, gross motor, low vision, neurodevelopment, and OT makes sure patients can do their daily activities and more complex activities. You might even say OTs are the best discipline to determine discharge. They don't just assess ambulation, but they make sure a patient can walk their normal household distances. They don't just assess transfers, but they see if a patient can get on and off those low seats in their homes. You might think walking is the most important activity to determine discharge, but the highest metabolic activity in the home isn't walking. It's usually showering. And OTs can determine if a patient has the functional ability and MET levels to perform that activity. Another reason doctors need to order OT is to assess cognition. 40% of patients in the hospital have a cognitive impairment. And I see this every day at the hospital I work at, and I'm usually one of the few people who actually catch it. This just happened to me the other day. I had a patient who had a stroke, and it seemed like all of their symptoms had resolved. The doctors told him to go home, but the patient had difficulty with memory, problem solving, and visual perceptual problems that could have caused him to have a car accident on the way home. And he lived alone. If I hadn't stepped in, who knows what could have happened. After a patient goes home, they may have had practiced those daily activities in a hospital or rehab, but now they need to do home health OT to practice those skills in the real world. They may even need a driver rehab specialist to see if they are cognitively fit to drive. OT is not just needed in a hospital setting, but along the entire path to recovery. To sum it up, OT is not just making sure a patient can brush their teeth or put on socks. OT is looking at the big picture. So the next time a doctor thinks about ordering PT only, they should consider the disservice they are providing by not ordering OT. While PT is great for assessing gait, ambulation distance, or stairs, OT does this and so much more in a more functional way. Feel free to share this with any doctor who doesn't order OT or see the purpose of OT. And share your thoughts below. Do you have doctors who don't order OT? Do you think OT makes a difference in determining discharge? And it would mean a lot if you could like this video And as always, subscribe and hit the bell icon. Thanks for watching.